Hey everybody, it's Monika and welcome to my channel where I help social workers, therapists, and helping professionals deepen their level of self-awareness and increase their competence and confidence in the profession. So for today, I wanted to talk about why you don't feel confident as a mental health therapist. So if you're interested in this topic, then please keep watching. I'm Monika Thomas, the founder and clinical social worker at Kindred Connections Therapy Center. I've been a social worker for over 12 years. I decided to do an entire YouTube channel on my journey from cubicle working social worker to successful entrepreneur. Welcome to my channel. So one of the things that I'm really passionate about is helping social workers not only excel in their careers, figure out different ways that they can increase their income, but also one of the things that I'm really passionate about is helping social workers increase their therapeutic skill set. So if you've watched this video right here, then you know that I did a mock CBT therapy session with a client who was experiencing anxiety. It was really my niece, but she played along with me. And in that video, I break down the basics of doing a CBT therapy session. And so many times I talk to therapists or they leave comments on my videos expressing concerns of feeling like they're a failure or that they're not competent enough or that they get nervous in therapy sessions or they're not comfortable with silences or sometimes their sessions stall out and they don't know what to say. They also express feelings of having imposter syndrome and a lot of self-doubt. And I do remember having feelings like this when I first started out as a therapist, but I didn't really know how commonplace it was until I started my YouTube channel. So one of the things that I wanted to do is I wanted to talk about the 4 things that typically come up when social workers express to me that they're not confident in their therapeutic skills. So I want you to see if any of these things apply to you. And the goal is to be able to move away from feelings of self-doubt and lack of confidence to position yourself as an expert in the profession who can demand the amount of money that you want, who can use your expertise to create content online or to start a business, or to be able to teach a specific skill set that you've developed a lot of expertise in. And just because you're teaching or you have a following or maybe you're coaching or you're using your degree in another way, just because you're putting yourself out there, that doesn't mean that you're 100% confident. We all have areas within our lives where we lack confidence, and I don't want anyone to walk away from this video thinking that you have to have it all together, because you really don't. So let me share with you some of the common things that I hear social workers say. So oftentimes they'll say things like, I don't know enough, or I just graduated, or my life is a mess. How can I sit down and talk to someone about how to improve their finances or improve their marriage or their relationship when things in my life are not in order? Therapy is not about you. Therapy is about the client. And the more comfortable that you can get in making the therapeutic relationship about the client and not about you, you'll see that your confidence will soar. So one of the reasons why I think that therapists lack confidence, one is because they don't have a passion for the work. Sometimes social workers or counselors, they go into therapy because they hear that it's the easiest way to make more money within the profession, or that they have the opportunity to go into private practice. So they think more about the money that they have the ability to make and not necessarily about the skill set that needs to be developed. Because when you really think about it, when you have a passion for something, oftentimes you go all in. You could spend days or even hours in the thing that you're passionate about, and there's really no limit to the amount of knowledge that you want to gain. But when you do things strictly for the money or the earning potential, or maybe you see it as a way out of a bad situation or a negative company culture, then that could be a sign that maybe you're not entering into the therapy field for the right reasons. Because it's easy to work in a traditional social work role and say, these people are getting on my nerves, I'm about to go do my own thing. So you start your own private practice, or you go work for a group practice, which gives you a little bit more independence, or you start doing independent contract work, which is how I started before I transitioned into private practice. So within our profession, we typically know that those roles give us a lot more freedom with our schedule, with our time, and with the types of clients that we want to see. But just because you have that freedom doesn't mean that you have passion for the work. And if you don't have passion for the work, then you're not going to spend the amount of time that you need developing your level of knowledge and expertise. So you really want to be honest with yourself around the reasons that you started as a therapist in the first place and determine whether or not the passion is even there for you to develop the confidence to do good work. Because for my definition of confidence, confidence is not about having all the answers. It's not being able to solve all the problems. It's just being able to have a bit of calm and ease at points of uncertainty. It's that feeling of knowing whatever happens, I can handle this. And that assurance comes not because you have all the answers, but because you know how to maneuver and you know how to pivot when things get hard or when solutions aren't readily available. And number two, which kind of goes along with not having a passion for the work, is that you've not developed the fundamentals. Or whether you've been trained in this line of thinking, therapy is a skill, and it's a skill that you can master. It's not just you sitting on the couch having a casual, leisurely conversation with your client. It's a very strategic process that you're working through to ultimately get to an end result, whether that's to decrease anxiety, to decrease stress, to help your clients better understand their feelings of depression, or to identify situations that trigger big emotional responses. It's to help them become more self-aware, to have emotional intelligence, and all of the things that you do are leading up to that end goal. All of the things that you say, all of the strategies that you use, it's all leading to that end goal. So oftentimes we get so caught up on the therapeutic modality that we fail to narrow in on one and to master that. So just like I did the CBT video, you want to read books, watch videos, do continuing education, all with having a fundamental knowledge that you can build up to mastery. So when you master the fundamentals, it doesn't mean that you use this huge therapeutic language or jargon. It actually means you learn how to simplify. You learn how to take very heavy, difficult, sometimes complex topics, and you learn how to simplify those and to explain those in very simple terms. So mastery is not your opportunity to show how much you know. It's actually to show how simply you can explain ideas and concepts. So I don't want you to get caught up on trying to learn or use or master all the elements of CBT and DBT and EMDR and solution-focused therapy, or helping clients connect with their inner child. And then on top of that, trying to memorize all the aspects of narcissistic personality disorder. Try to focus in on one area of expertise that you can build on. And when you're mastering the fundamentals, know that there are going to be aspects within therapy that you're not going to feel like you've mastered those things in your own life, and that's okay. As a therapist, helping someone have success in their own life doesn't mean that you have to have perfection in your own. And know that the challenges that you do have in your life, those are the things that make you more relatable to your clients. Those are the things that help you have points of connection and relatability. So don't think that you have to have it all together. I've actually found that clients prefer it if you don't. Number three, the other reason why you're not confident as a therapist is because you're spending too much time in your head and not enough time in your session. And what I mean by that is you're thinking too much about your own inadequacies, the thing that you're not saying, the thing that you're not doing, the strategy that you forgot, and then you're robbing yourself of the opportunity to be present with your client. Remember, this process is not about you and what's going on in your life and whether or not you're meeting your own personal expectations. You're here to help your client move through a change process. It's about how you can use what you know, the level of expertise that you have, and everything that you've been taught to help your client move out of some of the most difficult times of their lives. And if you're more focused on your own situation and what you're not doing and what you're not saying, then you lose the opportunity to focus the therapeutic process on their growth, their learning, and their development. And with this point, I want you to have enough self-awareness to know that there are times when you're absolutely going to be the facilitator, you're going to be the leader, you're going to be the one directing the therapeutic process. But then I want you to be self-aware enough to know that there's also times where you're going to be the student. You're going to be in the process learning right along with your client, and that's okay. And if you position yourself and feel like you have to have all the answers and you have to do all the problem solving, then sometimes you miss opportunities to learn right along with them in the session. It's been so many times when I've had a client explaining their situation to me, and I said to myself, I'm right there. I'm exactly where they are. I'm feeling the exact same way. The stress that they communicate, the overwhelm that they feel, sometimes the professional inadequacy that they talked about. I remember being in a session and a lady was telling me her situation of how she was dealing with all of these things in her life. And I literally almost welled up with tears, not because of her story, but because her story sounded so much like my life. And in that moment, I had so much humility because I knew that this was a moment where I didn't have to act like the expert. I didn't have to act like I had it all together. I could just create a relatable moment with her where we can just talk about what that felt like. And that's oftentimes when you get the most progress in your therapy sessions, when your clients feel like you're right there with them step by step and you're able to speak back to them the thing that they told you. So being able to reframe what they said, put it in your own words, but make it so relatable. They're like, yes, that's exactly how I felt. That's exactly what I was thinking. But it's because you're so entrenched and you feel those feelings just as they're describing them. Those are the things that helps you connect more with your clients. So oftentimes you can help give them the words and the language to describe what they're feeling because you know what it's like to be in those emotions. And when you're able to be in that relatable space, in that empathetic space, it moves you out of feeling judgment towards yourself, feeling like you don't have it all together, and then you're just able to flow within the session. And the beauty about this is that it puts you in the seat of learning right along with your client. Now, what I don't want you to do in this moment is have that dynamic flip when you're taking so much of their emotion in to where it's more like a venting session where they vent a little, then you vent a little, then they vent, then you vent. That's not the direction that you want your therapy process to take. You want it to be relatable to where you're empathetic to what they're experiencing, but you're always keeping that change process in mind and you're using that change-based language, also your motivational interviewing skills. And when I say foundational, motivational interviewing is about the most foundational that you can get. The third reason why you might not feel confident as a therapist is because you're seeking degrees over depth of knowledge. Now, don't get me wrong, I'm not judging you if you have a lot of actually Actually, I am judging you if you have a lot of degrees and certifications and letters behind your name simply for the fact that you think you're not adequate enough without those letters and without those credentials and without those certifications. What I want you to understand here is just because you have 10 letters behind your name, that does not make you more competent. And it's not going to increase your confidence at all. Because if you're just seeking certification and knowledge, it doesn't mean that you have a depth of knowledge around the area of that certification. And I know for me, I feel more confident when I know that I can't be caught off guard by a question or a scenario that I'm giving. And I can't be caught off guard when I know that I've done my research and when I know that I have a depth of knowledge because I know that I've studied about it, I've read about it, I've watched videos about it, I've had practice in whatever the thing is that we're discussing. So that helps me feel like I have a really solid foundation whenever I'm asked a question around something. And even if I don't have a specific detailed answer for whatever I'm being asked about, I know that I can relate it to an idea or a concept around that area of expertise. So for example, if I'm being asked about a cognitive behavioral therapy and how it relates to schizophrenia, for example, I don't have expertise in schizophrenia. That's not an area that I've thoroughly studied. I've worked with clients who have that diagnosis, but I don't have a depth of knowledge about schizophrenia. So what I would do is I would defer fully answering the question and then only focus on the aspect of CBT that I'm absolutely confident in. So I'll relate the knowledge that I already have and integrate some prior knowledge to answer the question. And I don't beat myself up about the fact that I'm not able to fully give an answer for the question that they ask. I think it's okay for us to know when we're operating outside of our scope, when something is beyond what we have the expertise in, and it's okay to say that. I think sometimes we get so concerned with appearing like the expert and knowing it all and having all the answers that we think we have to give these definitive answers for all the questions that we're asked. And I just don't believe that. And that brings me to point number 4, that it's okay to say that you don't know something. It's okay to say, I'm not sure, I don't know. I've thought about that, but I really don't have a really good answer for that. I'm not really sure. It's okay to not know. It's okay not to be the smartest person in the room. And it's also okay to default to someone else who has more knowledge and expertise than you do. It takes nothing away from you to refer someone to someone else. or to mention someone else's name if you know they have a certain expertise that you don't have. It doesn't make you seem incompetent. It doesn't make it seem like you don't know enough, and it doesn't make it seem like you're not smart enough. But what it does show is that you have enough self-awareness to know that you don't know all the answers, but you happen to know someone else who does. And this channel is all about deepening your level of self-awareness, and I feel like that's one of the highest levels of self-awareness, when you can get to a point to where you feel like you don't have to give an answer for the sake of being the smartest person in the room or being the one who knows it all. That you know that having other people around you who also have answers, that there's value in that as well. I don't think it does the social work community, the therapy community, or our clients any good to be so driven by ego that we can't default to our fellow colleague, or that we can't refer a client to someone who has a higher level of expertise, or we can't acknowledge that someone else is an expert in a subject area that we just might not be. Again, it takes nothing away from us to mention someone else's name, to give someone else a shout out, or to recommend someone who has a different level of expertise than you do. And I absolutely believe that that's another part of confidence, where you've been able to eliminate that FOMO, that fear of missing out. If you pass an opportunity on to someone else, there are a ton more opportunities that can come your way once you learn how to operate in an abundance mindset. So I hope you found this video helpful. If there's some other reasons why you think confidence might be an issue for you, or maybe you see something, or maybe you see a trend within the profession, please let me know in the comment section. I'd love to hear your thoughts. If you found this video helpful, please like, subscribe, and share. We're on the road to 100K followers on the channel. Thank you all so much for watching, and as always, be well.